Good morning, everybody. My name is Felicia A. I am a Frostburg University nursing student, and today I'm going to be discussing UTI prevention and education with you. Okay? So first I'll start with some background on UTI prevention and education. A urinary tract infection is an infection in any part of the urinary system. The urinary system is the body's drainage system for removing waste and extra water. It includes 2 kidneys, 2 ureters, a bladder, and a urethra. Urinary tract infections are the second most common type of infections that can occur in the body. A urinary tract infection occurs when bacteria enter the urinary tract through the urethra and multiply in the bladder. Most infections involve the lower urinary tract, which includes the bladder and the urethra. It's most common among women, and this is due to the short length of the urethra and the short distance between the urethra and the anus in which bacteria can easily travel. Most common UTIs: infection of the bladder, which is cystitis. That's caused by E. coli, which is a type of bacteria that's commonly found in the GI tract. So if that bacteria goes from the anus to the urethra, the genital area, then it can cause infection. Infection of the urethra, which is urethritis, occurs when GI bacteria spreads from the anus to the urethra. Symptoms of UTI include a strong presence or a strong persistent urge to urinate, a burning sensation when urinating, passing frequent small amounts of urine, urine that appears cloudy, strong smelling urine, urine that appears red, bright pink or cola colored, and pelvic pain in women, especially in the center of the pelvis around the area of the pubic bone. Other symptoms specific to older adults include incontinence, urinary retention, agitation, falls, decreased mobility, decreased appetite, and lethargy. So these symptoms are unique to the older adult population. Risk factors for a UTI include female anatomy, so females are more likely to contract a UTI due to the short distance between the urethra and the anus. Menopause, a decline in estrogen during menopause causes changes in the urinary tract that make women more vulnerable to a UTI infection. And then blockages in the urinary tract due to kidney stones or an enlarged prostate can trap urine in the bladder and increase the risk of developing a UTI. Other risk factors include a suppressed immune system due to diabetes or any other immune suppressing disorder or medication, catheter use or recent urinary procedure, dehydration, and adult undergarments or diapers not being changed frequently enough. So all of these can lead to a UTI. If a UTI does develop, treatment is usually antibiotics. That's usually the first line of treatment. Antibiotic and length of treatment depends on the type of bacteria that is present. Common drugs for simple UTIs include Bactrim and Septra, Macrodantin, Macrobid, and Keflex. Complicated UTI or kidney infection is usually treated with Cipro or Levaquin. And these are really strong antibiotics. They're usually only used if no other treatment option is available, because the risk associated with their use sometimes outweighs the benefits. And again, treatment, the length of treatment course depends on the type of bacteria. It's important to complete the treatment. Even if the symptoms resolve, it's important to continue to take the medication until it's all finished. And then pain medication may also be prescribed if there's pain associated with one of the symptoms. Potential complications from an untreated UTI is recurrent infections. Permanent kidney damage can occur if not treated. Damage from an acute or chronic kidney infection due to untreated UTI. Urethral narrowing in men is recurrent. In men from recurrent urethritis. And then sepsis can also occur if the bacteria spreads from the urinary tract into the bloodstream. So methods to prevent UTI include drinking plenty of liquids, especially water, to flush out any bacteria that could be there, drinking lots of cranberry juice, wiping from front to back so that you don't wipe bacteria from the anus to the urethra. Toileting often, so go to the bathroom often to release that urine or flush out any bacteria that could be there. Avoiding the use of adult diapers or changing them frequently if you do use them. And then practice good hygiene, especially if you have a catheter inserted or if you use a catheter to drain the urine. Okay? So thank you very much for your time today.